Okay. Okay, getting back to this, um, the um, things to look for in making sure you have therapeutic doses, like I said, are pretty straightforward. It's just a matter of committing them to memory. So when we are monitoring patients' blood values, we're looking for the coagulation time, the time it takes their blood to clot. Sometimes it's called clotting time. So like we said, with the non-activated PTT, just the regular PTT with no additives, the average time for blood clotting fully is about 60 to 70 seconds. So that's about the average PTT for the regular uncoagulated person. So let's look at both Coumadin and heparin. Coumadin, remember, uses PT or prothrombin time. So we said that the average PT is 11 to 13 seconds. Now, a therapeutic rate, a rate that tells you that you have reached a therapeutic level of Coumadin, is 1.5 to 2.5 times normal. So normal generally is referred to as your baseline or your control time. So baseline and control are two phrases you might hear when you're referring to somebody's initial uncoagulated time. So let's say that a person comes in and we'll say that their PT uncoagulated is 12 seconds. That is, a nice even number. So since we are looking for a therapeutic rate at 1.5 to 2.5 times normal, you're just going to take that initial PT, the control PT, and you're going to multiply it by 1.5. And what do you get for the number 12 times 1.5? You get 18. Then take that number 12 and multiply it by 2.5. And what do you get? You get 30. So a therapeutic level of Coumadin, if you start with a PT of 12 and you wait until that clotting time is 1.5 to 2.5 times the normal, you've got a clotting time that goes from 12 seconds to 18 to 30 seconds. And if you're in that range from 18 to 30, you know that that person is at a therapeutic level of Coumadin, and you can kind of stay there wherever you are with the dosage. Now your INR, remember how I said that's not counted in seconds, it's a straight number. So the average INR of a patient on Coumadin is supposed to be 2 to 3. And that is standard. You're going to see that standard INR everywhere. If somebody's on Coumadin, they're going to measure the PT INR. The PT should be 1.5 to 2.5 times longer than it was when they first started, before they were coagulated. And your INR needs to be 2 to 3. Now, that number is going to be higher if a patient had valve replacement, because they want, especially if they replace a valve with the plastic and metal type valve, it would be very easy for blood cells to get caught on that and start clotting and form a clot around that valve. So they want an even longer clotting time. So they're going to do an INR of maybe 3 to 4 if you have valve replacements. But just the average person on Coumadin for a history of blood clots is going to be 2 to 3. Now, when it comes to heparin, the good thing about figuring out clotting times is that both types of anticoagulants require the therapeutic level to be 1.5 to 2.5 times the control value or the normal value. So that's all you have to remember, is to multiply 1.5 times the control to 2.5 times the control. So remember, we said that heparin goes by activated partial thromboplastin time. And if you look on the last slide, the average activated PTT is about 30 to 40 seconds. So let's say it was 40 seconds. Let's say they draw your blood, you're not coagulated yet, or you're not anticoagulated yet. Your control activated PTT is 40 seconds. So you just take 40 times 1.5, and you're going to get 60, because 1 times 40 is 40, 0.5 times 40 is 20. So 60 is the basic control value. And then 40 times 2 is 80. 40 times 0.5 is 20. So you're going to get a activated PTT of 60 to 100 seconds. So all you have to do is take whatever the person's normal value is before they were coagulated and multiply it by 1.5 to 2.5. And that range in there is what you consider your therapeutic range. Generally speaking, you're going to check an activated PTT 30 minutes before the next heparin dose. Sometimes the heparin doses are going to be intermittent. You're not going to be hooked up to it all the time. So the nurse will come in and hang a bag of heparin IV and infuse it over, 30 minutes to an hour. So if they want to check what your APTT is, they're going to draw it 30 minutes before that next heparin dose is due. So say you get heparin IV at 9 a.m. and 9 p.m., they're going to come in at 8:30 a.m. and they're going to check your activated PTT. Now, if you have a continuous heparin infusion, or if you're getting an intermittent infusion at the time, you're going to draw the blood from the opposite arm as the heparin infusion. You do not want to risk accidentally getting some heparin into that blood vial and having it contaminate and interfere with your results. So if your heparin is infusing into your left arm, you're going to get your blood draws from your right arm.